Now let's talk about the biggest elephant in the room right now, COVID. Here's a graph showing our spiking case counts over the last week or so. Check it out over there to the right. The Oregon Health Authority just released these numbers after a delay over the holiday weekend. Last Thursday, December 30th, Oregon reported more than 3,500 cases that one day. That's the state's highest daily total ever. And remember, it does not include all those folks doing home tests and learning that they're positive. If you can believe it, health experts only expect it's going to get worse. They think that will happen in a week to 17 days. Oddly specific, I know, but that's what they said. They worry it could overwhelm the hospitals. The Omicron variant, according to the experts, is flourishing in Oregon, and we're about to see the sort of outbreaks the rest of the country is already living with. Peter Graven is the OHSU expert who crafts the virus prediction for Oregon.
What we're seeing is a trend, and it's zeroing in on Oregon next. It's essentially imminent. We know that Omicron makes up, a large share of all the cases right now, and is expected to spread through both the vaccinated and unvaccinated populations and shortly.
This graph shows COVID hospitalizations for Oregon as of late last week. That top line is all cases, and you can see the peak was early September. Then looking to the right, you can also see how things settled down. But now those cases are climbing again, and health leaders worry it will be worse this time than the September surge.
We were all predicting, and I was in a meeting this morning with all the other health systems in the region, that within these next 7 to 14 days, we should basically see things take off in a near linear straight line up.
Dr. Seth Podolsky is an emergency room doctor and the chief medical officer for Legacy Health. He said the speed of Omicron is troubling.
Omicron is different. We thought Delta was different, Pat, but Omicron is doing in about 4 weeks what Delta took about 4 months to do, and which prior strains took even longer to do. So the rise up with Omicron is almost a solid line.
He's a bit fixated on that solid line up for a reason. His hospital system and every other system in the state could be flooded with patients. Even though Omicron is thought to be less severe, the sheer number of people infected means the virus is more likely to find those whose immune system will struggle to fight back. It will be awful for those who get sick and for those who will work to save their lives.
So I truly, on behalf of all of my colleagues in medicine, implore you, plead with you, if you are not vaccinated, please get vaccinated. It is what we can do to protect one another, and it's our civic duty to protect our country.